Hi, this is Khali Reed. I'm a nurse practitioner, nurse anesthetist, and I'm an Endolift provider. So I have been providing Endolift for about 2 years. I made this video to help decrease the time we spent on video call. A lot of times people call me and they want to do consultation. They have no idea what Endolift is and what area we can use it for. So I wanted to just, educate you on what Endolift is and how we can help you using this device. So Endolift is a minimally invasive laser device. We use it to tighten the skin. We can also use it to melt fat and also facial rejuvenation. It uses a micro optical fiber. It's inserted in your skin, and introduces a heat energy, if you will. So the area that we treat will create collagen in that area. It tightens the skin and it reduces the fat in that area. So collagen is produced because we injure the tissue. It increases fibroblasts, and therefore you have a collagen build. So when the tissue is injured with the heat, the healing process involves retracting the skin back to the bone or muscle. That's how you see the skin retracting, getting tighter. It does increase a little bit of excess fluid drainage in the area because of the inflammatory response. So you will be swollen for 2 weeks after your procedure. So where can we use Endolift? Jawline contouring, double chin reduction, or submental fat reduction, cheek lifting, eyebrow lifting, tightening of the loose skin in the neck, thigh, abdomen. My favorite procedure is jawline contouring because sign of youth is V-shaped lower face. When we are older, we become square faced. We when we were in our 20s, 30s, if you look at your picture, you're going to have more upper face fullness versus in your 40s, 50s. I don't know how old you are, but as we get mature, we become square face. So the goal is always want to fill up the upper face, tighten the lower face. So because of that, jawline contouring is my favorite procedure. So we use local anesthetic. We put a BLT cream on there, and afterwards we use a local anesthetic, just like that your dentist uses it, and filtrate the area. We do endolift. There's no downtime. You can go to work next day. You will be using little tight faja straps in your face, chin area for 2 weeks while you're sleeping. So ideal candidate. Ideal candidate is people who are in their 40s, 50s, 60s, that they're not ready for a facelift. They want to tighten their skin. Also, people who have lost weight with Ozempic or tirzepatide, that they look a little bit of gaunt or empty. They have a loose skin. They are candidate for endolift. Also, Endolift works great with combination Morpheus 8. I have used Endolift with Sculptra on clients where they lost weight, they have temple hollowness, they started having the falling face effect where everything was just falling forward. So you fill up the lateral end of your face and you tighten the skin with Endolift. You are reversing aging process. I like dermal filler after endolift in the chin to make the chin sharper. Therefore, you have a V-shaped lower face. For men, I love Radius for jawline tightening, and it has been amazing product with combination with Endolift and Radius. And then I have just added Selenis PRP, and it's a filler made from your own blood. So we will draw about 8 tubes of blood from you, turn it into filler, and we inject it to your skin. I'm going to show you a couple of before and after pictures, and then I will look forward to talking to you on our Google Meet. Here you go. So this lady had a malar festoon under her eyes. It is a loose skin. It is actually genetic. That we used Endolift. This is before. This is after. 2 months later, looks better. 4 months, really results are shown better. This is both of the ladies in their 50s, early 50s and late 40s, and they had endolift done in their lower end of the face. Immediately you could see more definition and tightness. She is in her 40s. She needed some tightening of her lower face. Also, she did have a loose skin under her chin that became tighter. These are 2 months results. This gentleman is in his, I want to say 60s. He's not ready for facelift, so he wanted to do alternative treatment, which he came for endolift, and we did give him a one vial of Sculptra after 2 weeks later after his endolift. So that's all, and I hope you enjoyed this video. You can definitely like and you can share it with your friends and family, and I look forward to speaking with you